am I here? Hey, I am a busy mom on the go. As you can see, I'm in my workout gear right now. But guess what? I like having a fresh looking face. I want to be natural. And they have helped me specifically, Rebecca. Oh! It's trying to reconnect.
It's me. I know it's me.
Due to poor wireless connection. Okay, well, we're just gonna get started and finish what we're doing.
Yep, so we started with this nasolabial fold.
Okay, now Rebecca, I'm gonna start the live.
Start the live right now. Okay.
And hold on.
Okay. Okay. I am here with the lovely Maggie Thorne. We are so excited to have her here. Today we're going to showcase what it's like to get some subtle little enhancements with filler and Botox. That's really all we've done on Maggie. She's so pretty just in and of herself. All we needed to do was tweak a few little things. So we want to show you how easy it is to do this. And we want to make sure that you guys know that if you comment, like our page, share, you can get in on some major benefits: a free syringe of filler and 20 units of Botox. And that's really kind of what we're doing in Maggie today. And I'm so excited for you to see how natural it looks. So without further ado, do you have anything to add?
It's worth it, so make sure to comment for Sutton Dermatology and Aesthetics. I've been going here for a couple years, and as someone who has to be on primetime television, but day to day, I'm a busy mom of 3, and it's nice to be able to come in, have a quick procedure, and then head back out and be on my way.
Back out.
So make sure to comment and like their page.
No downtime. We're gonna do this quick. We already did one nasolabial
fold.
fold.
We already did one nasolabial fold. It was easy.
It's easy.
Easy as pie.
Right? Painless, Maggie?
It's very painless. So let's do the other side.
All right. I like making you symmetric. I think that's kind of important. There we go. We're using cannulas today, and the reason I do that is because it's really quick, and it pretty much eliminates the risk of bruising for patients. Minimizes swelling, not really uncomfortable. So let's go in here. We just work our way up into that nasolabial area. Let me know, Maggie, if I need to slow down, take a break. We know how tough she is. But I don't think she has to be tough for this. That's kind of the beauty of it. I've had patients say, Rebecca, I could fall asleep here. Now, that might not happen today with Maggie. She probably has too much on her plate. Too much to do, right?
I think it's pretty accurate, though. So right now, as she's working, I do not feel a single thing. I've trusted Rebecca for a long time now, almost half a decade. Getting on there, right?
Crazy.
Yeah, if we think about it.
I know, so long. When I first saw Maggie, the main concern was crow's feet. That was all we were treating. And that went so well. It was such a dramatic difference and looked so natural. Nobody would have known she'd had anything done. We decided to kind of springboard from there and soften her labella, this area between her brows. You know, sometimes we refer to those as the 11s. We wanted to soften those horizontal lines on her forehead. So right here, I'm just trying to create a nice, soft area of volume. So let me do just a little bit of massage there. Okay, still no pain, Maggie?
No.
Okay.
And I was just thinking I was going to emphasize how painless everything is.
Give me a big smile. Okay, awesome. That looks really, really good. We don't want to eliminate the nasolabial folds. And I've had a lot of patients ask me about that. The reason is because it doesn't look natural. We want to soften them, but babies have nasolabial folds. So, you know, adults should probably have
nasolabial folds.
Yeah, exactly. So this looks great. Let me do just a little bit more right here. And I think we could probably tweak those anterior cheeks just a little bit. You don't need much volume there at all, which is why we've kind of avoided those areas in the past. But just a tiny little pop of volume there, I think will make your eyes look a little bit more awake. So
I need that. I'm busy.
You're busy.
Rebecca, how long does something like this last then? The average person.
You know, honestly, when was the last time we did this, Maggie? in your nasolabial
So I'd
folds?
say, I remember getting close to 2 years, if we think about it. We're towards the end of 2017, and the last time was about the beginning of 2016, so maybe a year and a half we're at.
Yeah, yeah. And I would say you haven't lost everything. So
No.
we're just trying to update it and continue the improvement. So even after, you know, almost 2 years in patients, we're not back to baseline with most of our patients. We're just trying to continue to enhance, and we don't want to lose out on the nice benefits there. We want to keep it looking good.
I think maintenance, not only in terms of my body, but my face. It's important to me how I treat my body, and my face is just as important. So I love the downtime and consistency.
Yep, yep. And the little tiny tweaks like this, you know, mean we're not seeing a dramatic, whoa, what did she do? It's just, oh, she continues to look really fresh, really natural, and soft.
I think before most people realize that I have 3 kids, one of them being almost 12, an 8-year-old and a 6-year-old now. Is a lot of times they think I'm in my early 30s. I'm 36 now, or in my late 20s, and it's a pretty great feeling.
Isn't that awesome?
I love it.
So Maggie, just smile for me. Those are so much softer. Can you see that difference?
Yeah, it looks amazing.
Yeah, it looks really nice, and it just looks like your nasolabial folds are supposed to be that way.
Love it.
So I'm super happy with that. Let's do just a little bit on those anterior cheeks. And I have my product here. So this is just a little.
And I'd make sure in the comments of this video, if you have any questions, of course, ask questions, make comments. The great thing I loved about Sutton Dermatology is when I was doing my research is the knowledge they had in terms of dermatology as well as the aesthetics. I think that's extremely important.
Very much so. Yeah, I'd love to answer your questions. I've been doing this for over 10 years. I can't believe that at this point. Such a long time.
And you were here from the beginning, Rebecca?
From the beginning. I was the very first PA here in the Aesthetic Center. And, you know, it's a fun field to work in because it's constantly evolving and changing, and the techniques are a little bit of an ouch there. Just do a little bit of subtle enhancement. We've figured out ways to deliver the product to the areas that really doesn't traumatize the tissue too much, and I love that. I love being able to take these busy moms and do just a little refresher, and then they can go about their day. They don't feel like they have to hide out for a week or for several days. They can just go out feeling fabulous right from the get-go. With filler, it's immediate. You see it right after I've done it. Now sometimes we have a little bit of swelling associated with it, but I want to say you messaged me or texted me, Maggie.
I think I sent you a video message.
Or maybe a video message right afterwards, and you looked great. It was like that day or that afternoon.
I know most people are used to seeing me on TV, but my day-to-day is this, no makeup, mom on the go, and I love the fact that I feel confident and natural without my makeup and on the go.
That's awesome. Take tilt down just a bit. Okay, really nice. I'm going to give her just a smidge more here. And then we'll move on to that other side, okay?
Okay.
How are you feeling?
I feel good.
Feels a little weird, probably, but most patients actually don't find this part of the procedure to be that uncomfortable.
I feel like whenever you're at the helm of it, I'm pretty relaxed. So I trust your handiwork.
Thank you for saying that, Maggie. That means a lot for me. What do you think has made the biggest difference out of some of the things that we've done?
I think I was surprised at the difference filler made. I wasn't sure how much it was going to make. And then when we talked about it, and I felt like that's probably when I really started wearing a lot less makeup on my day-to-day. I don't have time for 1,000 creams. I don't want to put product on my face every day. I do like being able to be really natural.
Yeah, yeah.
And so I was really glad that I finally made that decision to do some filler, because it is dramatic. Since I have such high cheekbones, and you know, I had such large crow feet before I was even 30.
So it's kind of a genetic thing.
Yeah.
And that's
I love to smile, but not with deep crow feet.
I hear ya. I hear ya. Oh, I love that. You guys see the difference when you just have a relaxed pose, and the difference and the overall arch there and the cheek.
Yeah.
I mean, it's pretty.
I'm excited to see it.
No smile, just kind of flat affect. So you can see this is the area of volume loss on this side. We added just a smidge right here. And maybe we should let you take a peek, Maggie, so you can see.
Oh, yeah.
Can you see that difference?
Yeah.
Super subtle.
So,
But really,
subtle's
really
the
nice.
best.
Yep, yep. Okay. All right, so let's do the same thing over here. Again, symmetry is so important. Don't need to do anything with our fabulous lips. They're so pretty. Okay. Almost there, Maggie. Okay. So, might feel just a little bit of pressure as we're going over into that anterior cheek. You okay? A little bit of pressure. There we go. Perfect. Perfect. Excellent.
So as Rebecca had mentioned, I started out with some BOTOX for crow's feet, and then eventually did some forehead. And every time I've fallen in love with all of the results.
I think a lot of people come in here, especially athletes like you, Maggie, and there's this fear that I'm going to look done, or I'm going to look artificial, or you know, and I think it's important for people to know that it is such a huge priority for us here, for our patients to just be their best self, really. We're not at all trying to, you know, change bone structure or anything like that. We just want to, you know, subtly add volume where you need it, and make sure we don't add volume where you don't need it. Maggie doesn't need any volume in her cheeks. She has genetically really awesome cheeks, really awesome lips. We don't have to do anything there. A really nice jawline. So where she needed a little bit of help was just, you know, the nasolabial folds. I think they look so much softer, and that was so easy, so quick. And then right here, just a little bit of subtle enhancement on those anterior cheeks, so that that doesn't shadow.
And painless.
Photographs. And yeah, pretty much painless, right?
Yeah.
Yay, I love to hear that. Okay, now we can jump right into Dysport, or we can stop and do something else. I mean, what do you guys think? Jump right into doing Dysport?
If you're ready, let's do it.
I'm ready. Okay, so I'm going to lower you back just a little bit. Okay. I'm going to change my gloves. Any questions yet about what we're doing? I mean, I know a cannula sometimes is a little scary to patients, but it really is the safest way to deliver product to the area. It honestly is.
See if I can get my live drawing.
Alright, let's do this.
Maggie's going to be on Instagram doing a video from her perspective.
Checking it out. It's going.
Oh, that's pretty. Oh, I love it. Okay. I don't love what I do at all.
Rebecca is truly an artist. She's truly an artist, and that's what it takes, honestly, for filler, and it does take an artistic eye.
It is, like, weird. Oh, I actually got some comments from some people who are on the live. They said your live was interrupted.
I know.
I just saw you, and I'm getting questions about it.
Okay, well, we will be up. We will be back up. It's just not live.
I'm not live right now, but people were messaging me.
Oh, nice.
Oh, I love it. I love it. Can we get you live?
It's not going, so I might have to
record and just post later. Okay. That's what we're doing here, but we'll make it work.
Okay.
And I think people need to realize that Botox is such a commodity nowadays, but it is so important who does it and where it's placed. It's truly important because it can be not done correctly. And how small the actual needle is. People that see it.
Should we show that?
Well,
Yeah.
we're showing it right now.
Well, hey
but
everybody,
you know,
Yeah.
as you know, if you watched my Instagram story, I had a very busy morning. I was training. I'm still in what I was training in. And one of the things that is important to me, number one, is this lady right here, Rebecca from Sutton Dermatology and Aesthetics. But also being able to keep fresh face. I take care of my body, and I think it's important to take care of my face too. So I'm actually going to be getting a little bit of Botox, and there's a little teeny tiny baby, so adorable,
isn't it
adorable needle. And I'm just going to be getting a refresher. The last time I had it was in February, and Rebecca has been my master arts craft for almost half a decade now. So I'm going to post this, and if anybody has questions, feel free to message me. I've been at Sutton Dermatology. I'm getting used to it.
They changed her name.
They changed their name,
Yeah.
and they're moving to a super, super cool new place. So I want to show people that this is not scary. And number two, it's okay. I'm a busy mom. I don't want to use 5 million creams on my face. And I love not wearing makeup every day. I love feeling natural. So let's hit it.
And we just did her nasolabial folds. Look at this, you guys.
I just had some filler.
Does it look like she's
not
had
in my lips.
anything done? No, these are El Natural.
These
Cheeks.
are mine.
Cheeks, El Natural. We just did a little bit right there, a little bit right there, and you can't even see that she's had anything done except she's enhanced a little bit. So I think that's really important. There's really such a subtle, natural look there.
We take care of the rest of our body so well.
Mm-hmm. Take care of this too, friends. Let's go. All right, here we go. Little pinch. Go ahead and scalp. Yep. Relax. Reach up. Okay. Scalp. Relax. Little pinch. Okay. Scalp. Relax. Little pinch. Pretty easy, right, Maggie? I mean,
Super easy.
pain level? On a scale of 1 to 10, with 10 being
0.25.
0.25.
There's a little pinch, just like a mosquito.
I'm gonna call that a win.
I think a mosquito might feel worse. It doesn't feel bad at all. And the cool
Yeah.
thing is, I'm gonna have this done and walk out the door and grocery
Okay.
shop. I'm gonna
Double
go get
diluted.
things done.
Forehead. Okay. Forehead to soften these, and these pretty much go away, don't they, Maggie?
Yeah,
Okay.
absolutely.
Here we go. Okay.
So I haven't been here for very long, and we did a little bit of numbing before the filler, and then now we're doing the Botox.
Okay, raise up again, and then relax. Little pinch. This takes a little bit longer to kick in. Have you turned this way? Perfect. About 2 weeks before you see the full effect. Whereas filler is right then and there, immediate. So they work in different ways. Filler is going to revolumize in the areas where we're volume depleted, and that just happens with age. Starting at the age of 25, we start losing a teaspoon, I think, of collagen almost every year. Go
Just
ahead
a
and
spoonful
just-
of collagen
just a
and Botox help the wrinkles go away. All right.
here we go, little pinch. Almost there.
And friends, make sure to go over to Sutton Dermatology and Aesthetics page, and that's SUTTON Dermatology and Aesthetics, because guess what? If you comment on their video, you could win. What is it? What are they going to win again?
Free syringe. So we just did a syringe right here, and then 20 units of Botox, which would be the equivalent of what we've done in the forehead.
But you have to
So-
like their page and
Mhm.
comment on their video.
That's right.
Not my video, their video.
And share it.
But you can comment on Maggie's too, because
Yeah.
hers is awesome.
Ask me what you want. I'm an open book, friends.
Go ahead and raise your brows, yep, and relax. Little pinch. Okay. Almost there. Let me move around here.
Okay. Good. That arm was getting tired.
Yeah. And then raise up again for me. Okay, relax. These are for those tiny little commas to make sure that Maggie has a really nice, smooth, uniform brow. All right, crow's feet. Yep. And we bless these a bit because Maggie smiles a lot.
So right now, they're coming out.
This is going to go away.
It's going to go away.
Completely. All right, here we go. Little pinch. Perfect. Okay, little pinch. Little pinch. Okay, little pinch. Great job. How was that, Maggie?
That's great.
I mean, compared to Spartan, I mean,
Oh.
seriously, does anything hurt compared to
I think
that?
when you got 3 kids and you're stepping on Legos and Barbies and little Shopkins, there's a lot of things.
Go ahead and wink. And then raise your brows up. And then relax. Little pinch. So this is going to open up the outside of Maggie's eyes and take care of the crow's feet, but it also gives her just a little bit of brow lift. So she looks a little bit more awake. Even if she's really tired, which I'm sure she is, she doesn't have to look tired. There we go.
No, Rebecca,
Okay.
Botox doesn't last as long as filler does. So how
Botox-
long does it last?
It lasts about 3 to 4 months, depending on the patient. But in Maggie, it's been since February, since we last did her Botox. So, you know, in somebody who's young, we tend to see a little bit more longevity, up to 6 months sometimes. And if you're consistent with it at first, every 3 months, for the first year, we typically can space it out to 5 to 6. So it becomes a lot less expensive over time and more doable. And sometimes we can even reduce the dose. So I think in Maggie's case, it's kind of amazing with how active she is, how long the Dysport, Botox, and the filler lasts. I mean, we get a really nice amount of longevity, and that's because she was really consistent in the beginning. And
I did start out about 3 times a year, and then this will be the second one, and
like
that
twice.
will finish out the year.
Yeah, so I think that's pretty typical, and it's also the fact that Maggie's young. You know, that helps out too. So if you start early, you prevent these lines and wrinkles from becoming etched in, and it's a lot easier to get a really nice, smooth result. So I would love to see you guys here. It'd be so much fun.
I would love for you to see them. Friends, it's so easy, and I decided to share this because I think that women shouldn't feel ashamed about it. It's great to feel natural and youthful, and I'm certainly a busy person, and it's literally so easy. I'm going to walk out that door just as quick as I walked in. Little to no downtime. I'll take a day off from physical activity to let everything settle in. And
no alcohol, no exercise. This is the kicker for 24 hours. But, you know, then you're good.
And I'm good.
From there on out. So.
All right, follow their page, like their page, Sutton Dermatology and Aesthetics. And again, this is, did I call you Dr. Rebecca?
Call me Rebecca. I'm a PA.
I'm
not a doctor.
She's a wizard. I'll call her the wizard. Mastery. Thank you, and check them out.